Well, good morning, everyone. Thank you for joining me today for this fun training that I have in store for us. I know a lot of you out there use devices for different types of microchanneling, microneedling, collagen induction therapy, whatever you want to call it. Well, I'm here today to go over how the DermaFrac, which is a suction assisted microchanneling device, can help your clients, in particular your male clients. And I think we overlook a lot of our male clients and their needs and their desires. They really are trying to up their game and they want to stay in the youthfulness of their skin as well. So, this is what we need to do. We need to educate our husbands, our boyfriends, our male clients. And the way to do it is with before pictures, after pictures, things like that, that they can really relate to. And what we're going to do today is actually talk about how to frack a man. And there's a different way to microchannel, microdermabrade our male clients versus our female clients. So I want to go over a little bit with that with you. So if you are watching, please in the chat box, let me know where you're watching from. And if you're finding this useful, I'll go through a little bit about what the DermaFrac does because I see that some of you that I'm seeing in the chat already don't have a DermaFrac. And if you don't and you're looking to add microchanneling to your menu, please consider the DermaFrac for many reasons that I'll go over in just a few minutes. And for those that maybe are hopping on, you don't even know who I am. I'm Stephanie Halvik. I'm a registered nurse, owner of RN Faces, and I educate and distribute the DermaFrac. And I'm here today to perform one of my supportive trainings to my clients that do purchase and want to DermaFrac their clients. And the male client, especially this time of the year, Valentine's Day, is right around the corner, and we want to be able to service those clients as well. So let me get through with some of this. Now, I'm going to shrink myself down here, I think. Well, and that didn't work. So I'm just going to show you a quick little video here of the DermaFrac in slow motion. So what you're seeing is suction assisted microchanneling. As the skin is sucked up, the needles that are either 0.25 or here 0.5 pull the skin up to the needle where the needle is bathed in a specific serum. So I'll go over some of these with you as we move along here. And I wanted to make this quick because I don't like to belabor these too long. But this is the video. We're going to get to it, that I'm going to show you what this condition is and how we can remedy it to a degree. Okay, so this is what I'll be microchanneling today for you in this video. But before I get started, for those of you who are interested in the DermaFrac, how it works, you want to see results, you want to see how other estheticians are using it. Well, then here is my group on Facebook. It's the DermaFrac group. If you get your phone and you can get that QR code, you'll be able to get right into the group and just answer a few questions. And for sure, you'll be able to do that. Brenda asks, is it better to say microchanneling instead of microneedling when doing the DermaFrac? No, they're interchangeable. And don't let anybody tell you that they're not interchangeable. Microneedling is microchanneling, collagen induction therapy, multi-tryptanic collagen actuation. They have many names. But I think there are companies out there that want you to like dumb it down a little bit because some states don't allow microchanneling or microneedling. So they feel like they're pulling a fast one over on boards, and you don't want to do that. So, but it's microchanneling, microneedling, and collagen induction therapy. Call it whatever you like, but it's all the same thing. Tiny needles going into the skin, and in our case, pulling the skin up to them, making it super comfortable. Thanks for that question, Brenda. Love it, and love that you are a provider. I hope you're going to like this training too. So let me get moving here. Thanks for asking that. Um, Okay, so what is this condition? Cutis Rhomboidalis Nuchae. So this is a condition, it's chronic. We see it on the back of a lot of our male clients, our more mature male clients. And it's from sun damage. They form these really thick wrinkles. And as you can see, the rhomboid shape to it. So that's how it gets its name. And it can itch, it can be uncomfortable. I'm going to show you on my husband how his has developed. And his is a little red and itchy, and what I have done to help him. So, this is something that if a client does come in, do we want to put them on a package of DermaFrac? Well, I'm very ethical, and this truly is not something that a client will see a dramatic result in. So I don't feel like a package of DermaFrac would be ethical. So I would do treatments if they like. And of course, they will get improvement in the skin. But with something this deep, there's other treatments, and they too are still not something that will make the client go, wow. So the best way to treat these is with prevention. So if you have clients, your female clients, let them know about this condition. Show them some pictures. See if their young partners are starting to develop these types of lines in their neck. Now, my husband was a lifeguard for years when he was young. And, at that time, they weren't protecting themselves with SPF. And so, coupled that with other activities in the sun, that can really take a toll on the back of the neck. And sometimes we call this condition leather neck, sailor's neck. But all in all, it's unattractive, and men today are going to do whatever they can to prevent this. And now there are things. So microchanneling is one of them. So is sunblock, protective clothing, good skincare, moisturizers, chemical peels, laser treatments. Those are the things that will prevent them from getting super deep. But will it help someone in this condition? Probably not. But you can always help the texture of the skin. And people always want to ask me, like, Steph, why would I do a DermaFrac over, say, Procel, which I used to use, or a pen, which I used to use, or rollers, which I used to use? Well, my quick answer is this. Most men and women don't have all the time in the world to do those treatments. So the DermaFrac is only a 30-minute treatment from top to bottom. It's the lowest cost of USA consumables out there. So your cost per procedure is much lower than Procel or the doctor pens, all of those that have a very high consumable cost. And you have to pass that on to your client. Plus, then it's going to take longer. I know I used to do them. I always had to numb my clients. With this, you don't need to numb. I don't use a sheet mask at the end of the procedure, but that doesn't mean that you can't doll it up a bit, fluff it up a little bit more. You could do that, of course. And I feel like these are the most efficacious and quickest results because when I do perform a package for hyperpigmentation, for skin topic, when the topography of the skin is a little off, I can get them their results much quicker by doing it every other week and the week in between doing a peel. This way, they're getting their condensed package and they're going to get their quicker results. And then that means that they're going to be able to come back every month or when they see fit to get another treatment. And something like this is very duplicatable. So if you have a spa or an office where there are multiple operators, the DermaFrac makes perfect sense. It being only 30 minutes, it could be shared with other estheticians or skincare professionals. And then it makes it so that everyone does it the same way. If you train with me, I train by zones, I get everybody doing it exactly the same way. There is so much to be said for sometimes a little bit of a cookie cutter aspect of doing a procedure. And if you have multiple operators, that really does help. And if you do have questions, please pop them into the chat box. I will check them in just a moment. So I wanted you to see up close what these roller heads look like. You can see the green designates that it's a 0.5. And you can see the tiny little needles on the roller. So these needle heads are disposable and they come in a box like this with the serum, which I will show you next. There are different serums, and if you want to know all of the ingredients of these serums, the protocols for these serums, in my group DermaFrac, go to Files, and you will see each protocol and ingredients. So that's important in my group. And so the syringe of serum is 10 cc's, 10 milliliters, slips into the handpiece, and off you go. It is super easy to use. And let's see. And I just want to show you when you do, this is just a quick little picture of pulling up the skin into those needles, which guarantees that you're going to get it in at the exact specificity of your 0.5 or 0.25. There's no guessing. If you're not stamping and maybe stamping light and just barely touching the skin, you're getting this in at the proper depth that you anticipated your treatment being done. And it also makes it comfortable when the skin is pulled from the bone on the forehead or the cheek or around the lips. It makes it so comfortable that you don't need numbing cream. And I honestly can say I have not used it. And when you don't use numbing cream and you're talking to your clients, that is a big game changer. Many times, the minute you mention, oh, yeah, well, we'll numb you for 20 minutes, they're like, oh, God, no, thank you. Well, I don't have to do that anymore. So, what does that mean for your practice? It means that if you want to do more microchanneling, you will because clients aren't afraid anymore. So, the nice thing about the DermaFrac as well is that it also performs microdermabrasion. And unlike other devices that say they do microdermabrasion, we'll go into that at another time when I talk more about microdermabrasion, but they're not all the same. Now, this microdermabrasion is awesome because each head is disposable. So for every microdermabrasion that you do, you are getting a fresh tip, meaning your client, you know that your client's getting the best microdermabrasion for their money. And it's crystal impregnated pads. and they glide over the skin. They do a wonderful job. The machine is very powerful. You've seen it in some of my other videos, but this is a great choice for microdermabrasion as well. Here is a quick video of the microdermabrasion in action.
So how do you all like this
before we get to the video on the neck. So I'll explain a little bit about how we actually go about doing that full microdermabrasion or microchanneling for a gentleman. So I do it in a different way, and you see that microdermabrasion is very nice. It really does a good job. So let me just get here.
So how do you all like?
Okay, so before I get to the video at hand, I wanted to explain a little bit about, oh, you're welcome, Denise. Thanks for hopping in. Much appreciated. Okay, so when I'm either dermafracking my client, especially my gentleman, I will always do the forehead, the cheek. Now, what comes into play is always the beard, maybe a mustache. Of course, I'm not going to go over any place where active hair is growing. So you can do the cheeks so long, I like for my gentlemen to shave prior to their procedure. And when I am microdermabrating or the microchanneling, instead of pulling on my hand pieces, I will go with the grain of their skin, of their hair. It's much more comfortable for them, and just want to be careful when I am doing the microchanneling, because it is gravity fed, so that syringe needs to be in the downward motion. But I go ahead and just glide it over the hair. So that way it's not going to be irritating for them. So then you think to yourself, okay, well, great. I have a very robust practice of men. Well, do you feel like they're really getting their money's worth, especially if they have like a nice beard, that real estate you're taking off the table for the procedure? So do you think to yourself, do I charge less? What do I do? No, you don't charge any less. What you will want to do is this. You'll want to do the forehead, the cheek, the nose, the neck, if they just have this area with a beard. But there's other real estate that men do need as well. Of course, earlobes are very important to do these procedures on. So you see me do the earlobes from time to time during the procedures. And the décolleté for a woman. Now, a man, you might want to, but more importantly, sometimes they may have some areas, boat slips in the front, that you're going to use your microchanneling device to encourage more follicle health, which will make the hair grow in those areas. And those maybe I would do a package on. But if it's a gentleman that doesn't really have that much hair loss, but you notice a few spots when they come in for their DermaFrac, give that extra added bonus of doing that. And also, I would recommend every male client get their neck done to help prevent the Cutis Rhomboidalis Nuchae, so that later on in their years, they will have a much smoother neck. So you can microderm that first and then get into it with your microchanneling. Now, let me shrink myself down because I want to, there we go. I want you to see this as best as you can. And of course, if you do have any questions in the chat box, please let me know. This will be available for replay too. So, what I have here is my husband. And so, what you want to do, and I didn't want to bore you with all of the details of his treatment, but we cleansed, we alcoholed. I did a grid formation of all of the skin on the back of his neck up to his head. You will see that. Let me just go ahead and start this because I think the video is quiet enough. Let me come back here. Okay, so I've already done a grid type fashion on his neck. I did vertical, horizontal. Now what I'm doing is going right into the belly of these wrinkles. And you can actually see the rhomboid effect. Are you seeing this? Brenda, if you're still watching, are you seeing? Oh, nope. Hang on. There we go. So I'm just going to let you see what this feels like. So if you time it, so I jumped up the suction, and I've already done the vertical and horizontal, but I just upped it a bit more because I wanted to get into those wrinkles with a deeper, and when I say deeper, it's still 0.5, but if you are getting into the belly of a wrinkle, you want to have that roller, as you will see, in line with that wrinkle, so that when your skin is being suctioned up into that little hole, then you are bathing it with the serum. Now, the serum that I chose for him was Hydrate. I could have maybe done a number of them. I could have used the Rejuvenate. I could have used the Growth Factor, but he's got some areas at the top that are red and irritated. So I wanted to use the Hydrate to encourage some more comfortable. You could see how it's red, but we use this even on skin. Maybe that's not compromised. I don't want to use it on compromised skin, but on skin that I know needs hydration. So his head was flexed, so there wasn't really that need for me to super stretch these lines. But you can see that doing something like this at a younger age will definitely encourage the skin to not wind up like this. Now, up in the areas where there's a little bit more hair, and my husband likes to keep his cut nice and tight, as you can see, you aren't always able to roll and get that suction. So you see that I like to use the kisses because they can get in there, and when you have it up to a 5, our machine goes 1 to 5. When you use it at 5, you're really getting that suction to pull in the belly, and you might be getting into the skin a little deeper than the 0.5 because that skin is a little thinner in those areas. So, and you're getting, like, if you can look at the topography, you can see the epidermis around the belly of the line. Well, deeper into that belly is very thin skin. So you can really get these because of the thinness of the roller. Be super exact. So if you're using something like a pen or a stamp or even a roller, you can't get the precision that you can with DermaFrac. So, and to just be clear, because I did have somebody message me, they would like to see a before and after of this at some point. But you know what? Again, I'm not going to bamboozle my clients. He's my husband, so I could do as many treatments on him as he'll allow me. But will it really make a big difference? it'll make some difference, but it's not going to make enough difference for me to go ahead and charge a client for a package that maybe won't give him the desired results. But when he comes in for his DermaFrac treatment, I will always go and do the back of the neck. And here you can see where it was red, that I was able to get that hydrate serum into those areas that he actually says that they itch them sometimes and they burn a little bit. And that is also a symptom of Cutis Rhomboidalis Nuchae. So after the treatment, he did say, and that was today, after the treatment, he did say it tingled a little bit. We went ahead and used a little bit of our Definage, which is approved for microneedling directly after. So if you're using something from your line, just talk to your representative and make sure
like
that
if you were
it is
younger,
compatible
like in your
with
30s, like even tonight when he
microchanneling.
comes, I'll probably
Hello,
give him a
Moto.
treatment
Well, you're pretty
because,
amazing yourself
you know, prevention,
out there in
doing things like this,
Arizona.
doing peels,
So I was
laser
giving him a
treatments,
little
things
advice
like
while
that
he
will
was in
help.
my chair. But this would help all the way around the neck. So I just wanted to show you those key places where you should be concentrating on your younger clients to prevent this.
Are you more sensitive here or down here?
Down.
Oh, really? Okay.
Yeah. And I'm always really, really itchy from my EOP, that bony prominence down.
He was getting technical with me. But so yeah, so I will continue to do treatments on him and see how much he can get improvement. But again, prevention is how we are going to take care of this one. Let me go ahead, and I think you guys get the picture on that, right? So let me. And again, if you have questions, if you do have questions, you can always pop them in the chat box, or again, going to my group, DermaFrac group. That's where all the magic happens. You'll see great before and afters. Some of our providers just do such great work. And again, it's only 30-minute procedure, so your client's time is valuable to them and to you. So I hope that this was helpful in trying to decipher some of the things that we cannot do with some of the modalities that we have at our fingertips in our offices. So I so appreciate you guys following along with me, and stay tuned for more fun DermaFrac trainings, Skin Classic trainings, and Illuminate. Goodbye, everybody. Have a great day. Thanks again. Thanks, you guys.